Hi everybody, and welcome to our module on DNA drugs. There are a number of chemotherapy drugs that disrupt the function of DNA to kill tumor cells, and some of these I talk about in other modules like the anti-tumor antibiotics and the alkylating agents. In this video, what I'm going to do is focus on some other drugs that also disrupt DNA function, and those are the platinum agents and the drugs that inhibit topoisomerase 1 or 2. We'll start with the platinum agents. Drugs in this class include cisplatin, carboplatin, and oxyplatin. Shown on the screen is the structure of cisplatin. You can see that it has a platinum atom in the middle of it, and all of these platinum agents have a platinum atom in their structure. These drugs cross-link DNA similar to the alkylating agents, which I discuss in detail in another module. Most commonly, they do this at the N7 nitrogen of guanine, just like the alkylating agents. In fact, the platinum agents are often called alkylating-like drugs because they work via a similar mechanism. And just like the alkylating agents, these drugs are cell cycle nonspecific, and they can kill cancer cells in any phase of the cell cycle. These drugs are largely used in solid tumors. For example, they're used in both small cell and non-small cell lung cancer. They're also used in esophageal and gastric cancer, head and neck cancers, and also testicular and ovarian cancers. All of the platinum agents can cause neuropathy. This is usually a peripheral sensory neuropathy. It can present as pain, burning, or tingling, often in the feet or hands. These drugs may also cause ototoxicity or hearing loss, and in addition, they cause GI distress or nausea and vomiting in up to 90% of patients. Now, many chemotherapy agents cause nausea and vomiting, but the platinum agents are well-known culprits that result in these symptoms in the majority of patients. Nephrotoxicity is the main dose-limiting side effect of cisplatin. This often presents as acute kidney injury with a rise in the BUN and creatinine. This can be prevented by co-administering IV fluids, usually normal saline, together with cisplatin. This will increase the urine output. In other words, it will cause a diuresis, and this will move the cisplatin through the kidneys and limit the amount of time the kidneys are exposed to the drug. You can also limit nephrotoxicity by using a drug called amifostine. This is a free radical scavenger. This is its structure shown on the screen. It's been approved for use in ovarian cancer patients who require repeated cisplatin doses. And then finally, you should be aware that one of the advantages of carboplatin over cisplatin is that carboplatin has less renal toxicity. Now we're going to talk about drugs that inhibit DNA topoisomerases. So in order to do this, let's review what a topoisomerase enzyme does. As DNA is copied, it often becomes tangled or supercoiled, as shown on the bottom left side of the screen here. Topoisomerase enzymes will cut the DNA and then reseal it to get rid of those tangles and supercoils. So if you give a chemotherapy drug that inhibits a topoisomerase enzyme, what it will do is lead to a situation where the topoisomerase breaks DNA but does not reseal it. This will result in DNA damage and cause cell death. And these generally affect cells in the S and G2 phases. These are just after and during DNA synthesis. This is the time when the DNA tends to get supercoiled, and this is the time when those topoisomerases need to work properly. There are many different types of topoisomerase enzymes. Topoisomerase 1 breaks single strands of DNA and then reseals. Topoisomerase 2 can break double strands and then reseal. The topoisomerase 1 inhibitors are irinotecan and topotecan. These drugs are types of molecules called camptothecans. They come from the Camptotheca tree in China, which is also called the happy tree. Irinotecan is often used for colon cancer, and topotecan is often used for ovarian cancer and small cell lung cancer. Side effects of these drugs include myelosuppression, which is a common side effect of many chemotherapy drugs, and also severe diarrhea, which can be so severe that it can cause volume depletion. The topoisomerase 2 inhibitors are etoposide and tonopazide. These are both synthesized from naturally occurring substances called podophyllitoxins. These are toxic substances derived from the May apple plant, which is called podophyllum. That's how they get their name. These drugs are available in intravenous and oral use. They can be used for germ cell cancers, for all types of lung cancer, also for lymphomas, and their main side effects are really nothing special. They can cause myelosuppression and also nausea and vomiting. And that concludes our module on DNA drugs.